Great.
So we are live.
Great. Are there other people joining in? Hello, Anna.
Okay, sorry about that. That was a little technical glitch on my end. Good
Oh,
evening,
okay.
friends.
Good.
Good evening, colleagues. So this is module 2, and for those who will be watching this later, my name is Onaoluwa Abimbola, and this evening I'm here with MLS Chidindu, Mmadu-Okoli. So briefly, I'll summarize. She's a very amazing young medical laboratory scientist, and she's currently with DRASA, that is Dr. Stella Ameyo Adadevo Foundation. And our work in communication strategy is something that has caught my attention because for somebody who believes that we need to communicate better in the community, I see what she's doing as a way of helping other professionals to actually understand what we need to do to communicate our impact in the community. Uh, for her bio, I would say that I know that she's a 2022 YMLSF ambassador, and she also has some other certifications and qualifications to her name. But not to waste time, let's go on to why we are here this evening. So this evening, we are going to be talking about storytelling and branding for healthcare professionals. And we'll be using the interactive format. I'll ask her a couple of questions and then she can just share her knowledge with us and teach us from our own well of wisdom. So you're welcome, Chidindu.
Thank you very
It's a
much,
pleasure to have
Onaoluwa.
you here.
Yeah,
So,
it's a pleasure to be here. Thank you.
so for the first question, I would like to ask that you summarize why it's important for healthcare professionals, especially medical laboratory scientists, to have a good social media presence. And while you're talking about that, also talk about what that involves. What does it mean to have a good social media presence or to have um, an impactful social media presence?
Okay, great. Thank you very much, Onaoluwa, and to everyone who's listening, whether it's live or replay. I would say that the times are changing. The times are always shifting. So that means the things that probably worked in the days of our parents or grandparents, our grandparents, for instance, where if they wanted to pass any kind of information, they would go around with gongs, telling all the village people, street by street, or sometimes they will bring them to the square and inform them. Now you have to meet people where they are. People are already on social media. There's hardly anybody right now who is not on any social media platform, and that even includes WhatsApp, because I know
That's
people
true.
who are not on major platforms, but then they are on WhatsApp for convenience purposes. So it
Mhm.
means that health professionals must work towards meeting them where they are, as against waiting for whenever they come to the hospital. Remember also that health seeking behaviors of people are actually different. There are people who may not even, in a whole year, in 2 years, step their feet
Mhm.
into the hospital. And of
That's
course,
true.
prevention is always better than cure.
That's
So
true.
using social media means that you're meeting people where they are, and
Mhm.
giving them that information in a way that it's easy for them to understand. Because of course, for you to be on social
Mhm.
media, it means that you already know the kinds of speak or the language these people sort of hear when it comes to things around popular culture, and also you're able to craft narratives that align with both what you would do typically as a healthcare professional, and how that impacts the public, or somebody who needs that information at that particular point in time.
Mhm.
And then when it comes to the relevance of social media to, sorry, I think I'm missing the second question. Is it the what or the why? There's
No, I'm
another
saying,
question that you
what
had asked.
exactly does it mean to have an impactful social media presence as a healthcare
Okay.
professional? Mm,
Okay. To have an impactful social media presence, you have to make up your mind that you're out there using these platforms to
mhm.
express, not necessarily
Okay.
to impress. So expressing
Mhm,
means that from the bulk of your professional knowledge, from the bulk of your professional expertise, you
mm,
are teaching people, informing people, educating people, and of course,
mm,
infusing some aspects of entertainment, to make sure that these things are in such a way that people can grasp. So if for instance, you're on social media and you're not, using it in such a way that it influences people, and influence is not necessarily when you like have 1 million followers. It's very simple. I tell someone to drink water because the weather is
mm.
dry, and then they drink water and they acknowledge that, oh, I've been able to drink water severally because
Times.
somebody tweeted this or said this or wrote this or
Mhm,
wrote that, right? So it's
mm,
making sure that you're bringing your
mm,
expertise to those platforms, and like I
mhm.
said, you're making sure that you're informing people, you're educating them, basically speaking the language that they can understand in such a way
Uh-huh.
that they are aware of why it is important for them to take this medical or health advice, and of course
Mhm,
from you as already a licensed professional, a licensed medical
mhm,
laboratory scientist, a licensed healthcare
mm,
professional. And I mean, that's how you stay relevant on these platforms, if you use them
mm.
in this way.
Okay, thank you very much. I particularly like the idea of meeting them where
Where
they
they
are,
are.
because that is like, if you look at the number of people that come into the hospitals, into the laboratories, into the pharmacies, we don't get the millions. Like
True.
Nigeria has almost 200 million people. All of the data from all of the healthcare facilities across Nigeria that the Ministry of Health gets, we do not record those millions in the hospital. And I love that aspect, that we have to think of ways to meet them where they are, and that social media is like the community or village square of today.
Yeah.
Thank you for that. Thank you for that. So now, when we now say, okay, I'm ready to take social media seriously, I'm ready to start, posting for influence, not necessarily for, oh, for impact, not necessarily for influence, right? Was that how you put it?
I said to express. Of course, when you express, there's impact and
Okay.
influence, not to
Okay, to
impress.
express. Okay,
Yeah.
not to impress. All right, to express
Yeah.
and not to impress. So when you're ready to do that, so what are like the basic things that you have to have in place? And then, like, when you talk about social media branding, what exactly does it mean for the healthcare professional?
Okay. Um, this is quite a very dicey question because the word brand in itself has undergone too many metamorphoses, especially in this climb, where it's
Mm,
almost like you're one thing, outside, and then you're one thing when you want once you log in into your device. So I would
mm,
say that the first and most important thing is to know exactly who you are. There are
okay.
people who are, who basically are just, natural storytellers. And then there are different
Mm,
kinds of storytelling. There are people who
mm,
prefer to maybe write or to use
mm,
visuals, whether it's a video of
mhm,
their face or to speak with their voice.
mm.
Just know the kind of person that you are.
That's very
Know,
mhm,
your the why are you trying to use these platforms, right?
mm,
There are people who genuinely want to help people. There
mm,
are, of course, you can see what is currently conversation that's currently happening on social media as at today. There are people who are
mm,
actually on these platforms because they are looking for other means which are not, in line with the ethics of typically somebody who will be in medical practice, right? I'm talking about people outside of medical practice now. So you want to know um,
mm,
how you can use these platforms in a way that it serves your why. And of course, basically the why is that you want to reach people with health information that are actionable,
mhm,
that are relevant, and of course timely in a way that they can understand. And then when you
understand.
have established that, you want to also ask yourself what platforms align with the kind of information I want to push out.
Mm-hmm.
The people and
That's
that
true.
platform to be able
Mm,
to determine that you want to know where these people are. So, for instance, if you would like to, almost always use visuals, and then you want to reach a category of people who are like lay people with a particular type of information that is visually rich, you want to look at platforms like maybe Instagram, right?
mm,
If you are
that's
thinking of vocals, of course, some of these platforms allow for multimedia, but then the idea
mm,
is, from what I've learned, sometimes it's not so good to spread yourself very thin, because your
mm,
day-to-day job, your 9 to 5 is already tasking. You don't know,
that's true.
you don't want to put yourself in a position where you're showing up, across all four platforms, and then it becomes very
Mm,
overwhelming. So typically
mm,
it's like have a primary platform, and then the other ones are secondary. So if you decide that, oh, every day I'm going to, share something on Instagram, and then maybe every other day in the week I can now share some of the things I've shared on Instagram on the other platform. That is also,
mm,
fine and good. But then also remember that
mm,
the key word is to remain ethical. You don't want to typically do online what you would not do as you would, interface with patients day to day
mhm,
in your healthcare facility, or even in the communities, especially for those who do maybe community health work or field work, field laboratory work. Another
mm,
thing again is that for social media also, you want to make sure that the information that you're sharing are things that are verifiable per time. So with social media, because I do a lot of content for social media, especially for my organization, there's always that level of cross-checking information. What does the WHO
mm.
say about
Fact
this?
checking,
What is the
yeah.
latest information about this?
Mm,
If it is something that is specific to Nigeria, what are the top two public health organizations, or top three public health organizations saying about this particular thing? Maybe whether you want
mm,
to cross-check with the NCDC or the
mm,
NPHCDA or
mm,
Nigeria Institute of Medical Research. You want to make sure, because
mm,
what actually makes people lose interest over time is that somehow it's this thing you're giving me is Googleable. It's just how you
mm,
present it. And then when I go and
mm.
search on my own to verify the information that you have given me, and it turns out that it's not true, it means that
Oh,
you already have started losing audience. So you want to look
credibility, yeah.
at,
Mm,
yes, credibility. You want to look at the information that you share. You want to
mm,
also collaborate with other professionals, because
mhm,
naturally you're not supposed to even do this work alone. You will just burn out. There are times when you leverage on there are campaigns that, especially public health campaigns, that when they are being run, organizations reach out to certain kinds of influencers. Maybe they are not necessarily the ones who have larger audiences. I personally
mm,
have had to reach out to at least three medical laboratory scientists for campaigns that have been run between last year and this year, because
okay.
sometimes these things are things that are not done. You can't do it in solo, right? So it means
Mhm,
also that if you have another colleague on these platforms who are also sharing relevant information, you can curate
mhm,
their information. You can share
mhm,
also on your platform, and you can give them
mhm,
credits. You can say, oh, this is originally from so and so. It still boils down to you reaching out to your audience, and then giving credits to another group of person who, because of the way social media works, maybe the
mhm.
algorithm will sort of like turn your own profile for them to also see that there's another person who is also doing the kind of work
Same,
that the person
same
that they're
thing.
following is doing. So that
Mm,
means you're
mhm,
expanding your base, right, of
mhm,
followership, and reaching out to other people. So I think these are some of the things that come to mind for now. But if there are any other specific questions, I'm happy to
mm.
take them.
Yeah, thank you for sharing that. Actually, I I had this perspective too that you should choose one primary platform so as to avoid overwhelm. But this year I started modifying it because I lost out on a couple of opportunities because I focused on one platform last year, and by the time I would get to the other platforms, I saw I had messages I'd not attended to in like more than 3, 4 days. So, what do you think is the relevance of maybe scheduling platforms and scheduling apps like that, or using schedules? But that's like a little question that I want you to tie in with. Since you said we have to reach them where they are, then it's obvious that all of the people who want to reach out to may not be on one single platform. So how do we maximize, our storytelling efforts in, I mean, using as little time as possible? And then when you're done with that, I would also want you to quickly talk about the elements of storytelling as a healthcare professional. How do we tell stories that make more impact, that actually drive home the messages we are trying to pass across without losing the accuracy or the integrity of the healthcare information we are trying to pass across?
Okay, so I think I will take them one at a time. When the question about having to be on other platforms so that you can catch up on what's happening, I'm just going to speak from my experience leading social media, having what they call it, managing master calendars. I mean,
Okay.
for I would say roughly three plus years of my work life, social media is generally hard. I don't
Mhm.
want anybody to get deceived by thinking that it's just for you to be on these platforms. Remember that it's not just having content and posting across.
Mhm.
Remember that you also have to engage with people across these platforms. Remember that if there are messages, you also have to respond. If there are other further messages, so for instance, there was content that we put out last week and somebody needed clarification on something that was related to it, we had to go and start doing research to find if there's like a body that is in charge of cleaning spaces for us to be able to come up with an accurate figure for that. So I
Mhm.
don't want us to remove the reality that social media is a lot of work, especially with the content
Mhm.
creation and the monitoring. But I would say
Mhm.
if you have somebody that can do
Like
or sorry, if
virtual
you have a
assistant,
tool,
like a
if you
virtual
have a
assistant.
tool, yeah, that's also fine. But if you have,
Okay.
I mean, you have to know how much you're earning for you to be able to do that. But I'm talking about if you have a tool scheduling that can do the
Yeah.
scheduling, that's fine and
Yeah.
good. It removes, the work of having to post across all platforms.
Okay.
But also you have to go into those platforms to engage. You can't schedule your
Mhm.
reply. You can't know what somebody will say in the reply
Mhm.
for you to now
Mhm.
schedule a reply to those people, right? So I
Yeah.
can just only advise that if you're going to use those four platforms, make out time at specific times of the day to go to these
Mhm.
platforms to see if you
That's
have,
that.
the post
Yeah.
that you've scheduled. Is it that by
Yeah.
midday you have like a calendar reminder to go there and check,
Mhm.
some of the things that have been written there, and then you
Mhm.
engage because if you consistently put out something and people are engaging but you're not responding to them, over time they are going to stop, right? So that's the
Sorry,
danger
let
of
me let
being,
me add that by engaging, she means reply and respond to comments, because I know
of
some people
course.
who may be watching this later may not really be familiar with social media lingo. So that's,
Okay.
sorry, I had to put that in.
Okay. That being said, I think there's another question which is about the elements of storytelling or what to
Yeah.
keep in mind to be able to tell good
Mm.
stories. So, when you want to use storytelling in healthcare, they might not necessarily be things that you go to, fiction that you go to, fabricate or case
Mm.
studies. They can actually be real life scenarios. But when you're
Yes.
using real life scenarios, I want us
Mhm.
to think of also the ethics of storytelling. You don't want to
Yeah.
expose patient information in such a way that it is very obvious.
Mhm.
But also you want to use a main character to be able to say, oh, I want to educate about diabetes or lifestyle
Mhm.
choices that lead to diabetes. And then when you have a topic like that, you want to start
Mhm.
asking key questions like, for diabetes, for instance, you want to start asking key questions like, or 5 WH questions, which basically make up the
Mhm.
essence of storytelling. The why, what do they need, why do they need to know about this? Is there something that, the recent happening that people need to know about, especially with, diabetes and maybe diabetes research that, affects the
Mhm.
layperson on the streets? What exactly
Okay.
do they need to know? And you can break
Mhm.
this content across these 5 WH questions, which is like why,
Mhm.
the what, when. So if it's anything that has to do with when they need to, be able to eat, so that they can, regulate metabolism or anything like that.
Mhm.
Um, the how, if there's any, way that they can go about it, even
Yeah.
the where. Are there specific,
Mention. Mm.
locations or specific settings where people who live with
Mhm.
diabetes, should not find themselves. When you have that particular topic and then you ask yourself these questions around it, You now decide
Mm.
to, take it one at a time. You could probably have a week content, spend a whole week educating people about diabetes, where you're taking it
Mm.
one after the other. Today,
Mm.
you want to tell them, oh, maybe there's a new something about diabetes, a new, discovery about
Mm.
diabetes. What is it? Why do they need that information? And maybe the next day you can talk about, oh, how maybe people who are living with diabetes, can make better use of this information, or whatever research it is, to be
Mm.
able to extend their well-being and live longer. But I think
Mm.
that at the very core of any story is to ask yourself these core questions: the what, the why, the when, the where, the how, and sometimes it is the so what, because at the end of every content, people will ask, so what is in it for me? Right? Sometimes you're even writing, with or telling a story, or using a case study, or
Mm.
educating people about a disease with specific people in mind. And at the end of the day, people who will take that information are maybe the children or people living with that disease, right? So with
Mm.
so what, you can now say, now that you have all this information, I want you start, sharing actionable tips, right? So that makes, like, at the very basics, that basic, that is, what to look out for when you pick out a topic that you want to maybe use stories or use case studies, or just
Mm.
basically educate people about.
Mm. I like this five W's of storytelling, and I think this is one part I would emphasize, that everyone who watches this take their time to actually listen very well and understand how to get that done. So I want to ask if you have real life examples of where storytelling has actually helped to improve healthcare outcomes in any community. If you have like maybe a social media campaign that's you know
Okay,
answered
so
this theme.
I think there are quite a couple. It's not just my own personal experience. I think that there are quite a lot of them on social media, but I'm just going to mention two. And
Okay.
in 2019, I was a Prevent Epidemics Niger health journalism fellow. So it meant that
Okay.
we're going to use stories to, ask the government to please fund epidemic preparedness. This was like
Okay.
April to August, before COVID hit by the end of 2019, 2020.
Wow.
So
Mm.
as at that time, we had stories that were focused on things like, for instance, my story was focused on funding public health laboratories. And
Mm.
it was not just going ahead to say, government, please fund public health laboratories.
Health
There was a
laboratories.
story behind that. Yes, there was a story behind that. A doctor in one of the healthcare facilities had
Yeah.
come down with Lassa
Last
fever.
one. I remember.
And having come down with that Lassa fever, there were no, proper the laboratories were not properly equipped to handle that. I mean, the labs are not equipped. Who will come and start touching, those kinds of samples? So it meant that
Samples.
he was on isolation, getting
Mm.
worse while they were shipping samples to Irua. At the end of the day, I don't think that test was initially done. They had to start
Mm.
taking his samples, I think, to another country to run. It was as he was
Mm.
deteriorating that his colleagues had to take him to Iraq specialist hospital, and he
Mm.
was there. You can imagine being on admission every day. They are wheeling out somebody who is dead. Some
That's
people can
that's
even die on the dialysis machine,
yeah. Mm.
right? So these are like real life stories to say,
Mm.
oh, we're shining a torchlight on the aspects of healthcare that people need to
Mm.
pay attention to. Well, there were other couple of story projects, but I would say that the essence was to drive attention of the government towards funding
Mm.
health security, and I
Mm.
think we were able to get some form of allocation for the key health institution who was that was in charge of Nigeria's health security, which was NCDC, because that was like the essence of that particular advocacy. Another good
Advocacy.
example that really stands out for me
Mm.
for using social media or online platforms to tell stories is this particular primary healthcare center in Niger, where the doctors, the lab scientists, all the healthcare workers had abandoned the place because there were bats living in the primary healthcare
Mm.
structure.
That's
People
that's
couldn't
all.
give birth there. It was really abandoned. But now, a few kilometers away, in the same state, there's another primary healthcare center that is well equipped. They even have solar panels, right?
Wow.
So what a colleague did, he's a pharmacist who
Okay.
used to be a journalist. He went
Okay.
and took the story of the primary healthcare center that was working, and took
Okay.
also the story of the primary healthcare center that wasn't working, and did a
Mm-hmm.
very long story
Comparison.
saying why is
Mm,
this happening, right? And
mm,
after that story was published, a few months
mm,
after, the state, I think it was Niger State government, now
mhm,
went ahead to start working on that particular primary healthcare center that was bad. And before we knew what was
mhm,
happening, they had totally refurbished the whole place, renovated the whole place, equipped it. It now came
mm.
up even to be better than the other one that was, appeared better
Yes,
actually than
initially, yeah.
the other
Mm,
one that was there. So these are,
mm,
ways that we can use, online platforms, especially social media. There are other kinds
mm,
of campaigns currently going on. There's one for, I think HPV vaccine. There's been the one for
mm.
COVID. In fact, during COVID, almost everybody were on their toes, healthcare professionals educating the
Yeah,
public.
that's
And you
true.
can see that, yeah, you can see
Mm,
that Nigerians were actually very compliant because people started wearing, face masks, started washing their hands, even learned that there are people who
mm,
still keep hand sanitizers till today, and some people
mm,
also went out to get vaccinated. So I would say that these are
mm,
things that is collective efforts of healthcare workers leveraging social media that enabled
mm.
people to adopt these healthy behaviors.
Mm. These are very beautiful examples, and thank you for sharing them. I love the fact that you picked the one that was done by an individual, as well as the one that was done by a not-for-profit organization, Nigeria Health Watch, I believe. That was when you were the Prevent Epidemics Fellow, and the other one that was done by a single person who was a
As a
pharmacist and
journalist, yeah.
journalist. So that's those are beautiful examples because it shows that regardless of the institutional support that we have, we can actually drive change using social media and storytelling. So now, let me say, from those two experiences, when we don't have institutional support, what are the primary things that we must do to ensure that our storytelling actually reaches enough people in the community? Because when we talk about impact, it's about the reach and that it brings the change that we want to see. So, what are those things that must be present? Is it just about you? I like the fact that you've talked about having your own, knowing your own type of creativity, like knowing whether you're better with words or whether you're better with visuals. For instance, somebody like me, I prefer to write than to come on a live like this. So, in as much as we know that, what are the basic elements that must be in place before we can get the results we want?
So I would say that you can't exactly do storytelling in healthcare if there is no passion for it. And why I say
Passion.
it because this is your question about if there is no institutional support. I know
Yeah.
someone, I can't mention details here, who had
Mhm.
started using the platform that he has to make case about funding hospitals, making sure that things or systems in our hospital systems are working and all of that.
Mhm.
I don't think till today that he has institutional support. In fact, from what I know clearly, as at this moment, it is still being funded out of his own pockets. So I
Wow.
think it boils down to, in the
Mm.
absence of institutional support, maybe what will drive this person, or most likely drive this person, would basically be passion, and
Passion.
you have
Mm.
made up your mind that you want to play a long-term game.
Mm.
So I'll
Long
give it.
term game. Mm.
Yes, I'll give another case in point.
Mm.
There's a popular health
Mm.
influencer who had just shared that when he started, he went to radio stations to ask them to give him a certain slot. I mean, he was not asking them to pay him.
Mm.
I just want to, ensure that you have
Educate
a
the
health beat
people.
in your radio station, and I want to
Mm.
be the one who gives out that information. I'm qualified. I'm a
Mm.
medical doctor. It's something that comes naturally for me. I want to be able to do this. Nobody answered him. But then
Wow.
if he had stopped using leveraging his social platforms, to educate people and all, maybe by now people will not be looking for him, because right now it's people that are now looking for him, like both the radio and
Mm.
the TV people that are reaching out to say, oh, can you be here? Can you be there? Can you? So I
Can you
think you have to
come?
make up your
Mm.
mind basically. What is the specific contribution I can make as a healthcare provider walking this earth? And
Mm.
how can I do it in such a way, pace it easy in such a way that is sustainable, especially if you want
Mm.
to play a long-term game.
A long
Otherwise,
term game.
if you if you wholeheartedly, or will I say altogether,
mm,
totally depend on institutional support, it means that people might die. Because if you're waiting for
mm.
institutional support for
It
certain
may
things to
never
work in
come.
the hospital,
Mm,
it will. I know doctors who even donate blood for their patients. So if you're waiting
mm,
for all kinds of institutional support to come,
mm,
I might not really end well. So I think it's just having a healthy dose of passion, and doing it
mm.
in such a way that is sustainable, so that you also don't break down while you're doing it, and then you can do it for
How
long
you're
term.
doing it. Oh, thank you very much for that. Actually, I want to check if maybe people are already on the live and dropping comments. Let me just see if anyone
Okay.
has dropped any comments, uh, so that we can quickly add if there are any questions. Okay, I've not seen any questions yet.
Okay.
So let's continue. It's about 16 minutes to go, I think.
Okay. Hi, can you hear me?
Yes, I can hear you, please.
Oh, okay.
So, you briefly mentioned something about doing it ethically and making sure that we do not breach privacy and confidentiality when we are telling our stories. But I
Yes.
would want you
Hi, Anna. I can't hear you.
to, you can hear
Hello. Can
me.
you hear? I can hear you now. You said you want me to
Oh,
do something. I didn't hear the rest of the
yes.
question.
Yes, I said you briefly touched about confidentiality the other time, privacy, ethics, and all of
Mm-hmm.
that. That can you uh, explain in detail what does it mean to breach confidentiality, and how do you avoid that when sometimes social media is like you're doing something spontaneously, either you're typing or you're doing a live video. So what are the key things to make sure you never do, so that you don't fall
Okay.
a victim?
So I think first things first is all those things that we learned about ethics, especially in our various professions, are things that should apply with social media. In some countries, they now even have social media guidelines for people who are using for medical professionals who are using these platforms to educate. But I will give an example. When I was still active on Facebook, and that was like I think 2018 or so,
Wow.
2019, between 2018 to 2020.
Mm,
There's this nurse, quote unquote. I have to put that in quote because it was weird. Who had who was on who had a clinic day where she was working somewhere in Rivers, and it was a HIV clinic. So some hospitals have special programs for HIV people, and then these
mm.
people had come. They were waiting in line for drugs or waiting for
Wow.
care, and then this lady took a picture
Oh,
of
oh.
them. I think there were two, three of
Oh,
them,
oh.
and then
Oh,
put on
oh.
social media and
No,
said,
no, no.
um, I think he covered their faces and said, "Look at them. If they ask you people to stay safe from HIV now, you will say something like you say that they are pursuing you or something like that, or they are talking to you
What?
anyhow. Look at them like it
What?
was almost like very she was condemning them actually, irrespective of the
Wow.
fact that she had covered their faces. Now here's where it gets interesting. People started, calling her out in the comments to say, you shouldn't be doing this. It's not professional. Where did you read your own nursing and the likes? And then it happened that she now decided to go ahead and insult the people who were trying to call her out. Right? Hello, can you hear me? Hello. Let
Hello.
me know if you can hear me.
Yes, please continue. I got excited and my hand clicked on
Okay.
something.
Okay.
Wow.
So she puts that on her social media, on her Facebook, and people were wondering like, What kind of nurse will do this type of thing? And then they were in the comments telling her, pull down this post. It is unethical. It is not professional. And then she was
Mhm.
insulting these people in the comments, like replying to
Wow.
each reply and
Mm.
insulting them. And then even made another post saying, I'm not going to pull it down, all of that.
Mhm.
Making very arrogant statements, in under the guise of I'm trying to educate people and you're telling me that what I'm doing is wrong.
Wow.
Now, next thing that happens is people were able to find out the location where she was. They
Where
reached
she
out to the
was.
nursing and midwifery association. They reached out to the council and they got her
Mm.
arrested.
Wow.
What should have been the proper approach to telling this story on social media? First, there's no occasion where you should carry pictures of people at a clinic to use on
Mm.
social media.
Mm.
It erodes human dignity,
Mm.
especially because you do not even know how about they caught that disease.
Mm.
It is not even supposed to be your business in the first place. Do you
Mm.
understand? You don't know their
Mm.
human condition. They are in the clinic vulnerable, asking to be cared for by you. And then
Mm.
you take their pictures
Mm.
and put on social media. It shouldn't have been
Wow.
so in the first place. Because
Mm.
saying you cover their faces is not even enough. There could be other
Mm.
identifiers like the clothes that they're wearing,
Mm.
maybe their body marks on their bodies and all of that. So it should have never been
Mm.
so. So
Mm.
if that lady would have wanted to tell that story, it should be one without the identifiers, without the faces of these people.
These people, yeah.
If she wanted to tell that story, the names, if she even knew them, should be pseudonyms. There should be
Yeah.
aliases, not their real
Fake,
names,
fake names, yeah.
right?
Mm-hmm.
There should be aliases even for the location of that clinic if she needs to be, even though it's not necessary.
Mm. Mm.
Three, the tone of her words were really very condescending. When you
Mm.
want to educate people on social media, you don't speak at them,
Mm-hmm.
right?
Yeah.
You don't say things like, I see things like maybe people saying things like, you lots cannot do this, do that, do that. I'm here to remind you, if you don't want to, you don't use fear to speak to people because even the fear
Ah,
thing don't no longer works. I
really?
mean, yes, we have been doing things like telling people that smokers are liable to die young, but people are still smoking till today,
Okay,
right?
but that
Smokers
strategy
are
is
still
what our Proco doctor is using, and it's working, right? It kind
so
of, puts the fear of God in them with
no, it's not fair. I think that there's a way you put out facts that of course
okay.
it's quite the facts that you can't hide the facts. There are facts that are
Mm.
fearful,
Yeah,
definitely, right?
yeah.
But even in the Aproko doctor's approach, he presents something and presents a solution. In this particular context that
Hmm.
I'm talking about, the lady
Yeah,
just came and was like, "This is
like,
for all of you. That do you understand?
mm,
If I
yeah.
even feel like I need counseling or I need
Hmm.
advice, I would never go to this person because another thing is they are not empathetic. When you want
Hmm.
to write to or create content for people, you also try to put yourself in their shoes, in their
Yeah,
circumstance,
yeah. Mm,
right? So you want to
mm,
watch out for the kind of tone that you use. Like I said, don't speak at people. Sometimes it's better to say things like if you're going to start using second is it second person singular, like all these you, like it's better
mm.
sometimes to just mask it as we if it's going to make it
We,
easier, especially if people that you're addressing are people that can feel a lot of shame. I feel like
mm,
sometimes some of the challenges that we have with public health, especially with fishing out certain kinds of populations that actually need help. So, for instance, people who use drugs, um, and sometimes get to inject it in
alcoholics,
themselves,
yeah.
and are now, yeah, and are prone to maybe HIV and all. Part of the
Yeah.
reason we are not able to reach out to these people properly might just be because of languages like this.
Mm.
That approach was really wrong, and I'm very happy that that lady was arrested. So when it comes to ethics, I think it's just basically the branding is not different because you are online, right?
Mm.
What are those things you learn from basic? I think in med lab science from 300 to 100 level, you're already doing laboratory
Mm.
management and things around ethics. Other people should
Ethics,
also
yeah.
have been able to do it around that
Mm.
time. So you check what are
Mm.
those things that I shouldn't be doing, especially when it comes
Mm.
to the fact that I am actually addressing a fellow human
Yeah.
whose entire trust is in my hand as a licensed expert,
Mm.
to give them information, to give that information without being condescending or making them feel less of. I mean, these people already have a challenge. That's why they are coming to you as the expert. So now the way you now, speak to them, now maybe they'll just hide with the disease and then it maybe
Mm,
continues, excuse me, to spread across a community, and nobody knows
mm,
how to sort it because the people who live with them can't even come
mm.
out for fear of somebody
Okay.
taking a picture of them and putting out on social media. So I think you should
Mm,
check out for tone, be very empathetic,
mm.
make sure that privacy is the supreme thing.
Mm.
Prioritize it a whole lot.
So,
If you want to share stories,
um,
use anonymouses or aliases
so
to
what
tell
about
those kinds of stories.
outreaches? What about outreaches where you're actually trying to show that you have reached out to a certain number of people? Personally, I don't share stories or I don't share pictures of outreaches
Mm,
I organize because I organize outreaches
okay.
like every year. But I know that so many organizations use that as a means of raising support on social media where like they take pictures of the crowd that was attended to. So does that still fall under something we should watch out for while we're telling
So
our
when
stories?
I think that that is a kind of different setting.
Okay.
Now, if you're dealing with a crowd, there are different faces there.
Mm,
Depending on the health literacy levels or literacy levels of these people, they are
mm.
supposed to know ahead of time that pictures of them will be taken. But
Okay.
then,
Okay.
specifically, if you want to use certain beneficiaries to demonstrate impact, there's
Mm.
something called media release or media consent document, where
Document.
you
That's
get their
mm.
consent. You tell
Yeah.
them
That's
that I
good.
want to use this story. I want to learn, about your
Mm,
experience, what it was like
mm,
before we came, what it is
mm,
now, probably what you've learned, what you're carrying forward. Because you want
mm.
to use that as qualitative, I don't know whether it's called qualitative data, but storytelling
Qualitative.
is
Yes.
qualitative. Yes, to
Qualitative data.
demonstrate, yeah, to demonstrate impact. And these things
Mm,
are, I mean, it's not that you're just putting it out there because you want to put it out there. You have gotten
yeah.
their consent, you're putting it out because you want to demonstrate impact so that you can attract more funding and reach other
Mm,
communities, right?
mm,
Because of course, maybe
mm,
what you have done with these outreaches from your own pocket, you've done it maybe in a
mm,
community of maybe like 500 people. Should you want to
mm,
do it with in a community of 2,000, 5,000 people, you're not going to do it from your pocket, right?
mm,
So that's where storytelling is strategic. But before
mm,
you engage those kinds of people, because I mean, for projects like that we have also done, we get their
mm.
consent. Either it
Okay.
is for people who are not literate, they can use what they call it. They can use their thumbprint on the form.
Okay.
Those who are,
Mhm.
they can actually sign after reading to them.
Okay.
Those who are not, you explain what is in the consent form, and then
Consent
they
form.
fingerprint.
Mm,
Yes.
that's great. Thank you. So there was one aspect we missed out on earlier when we're talking about
Okay.
defining who you are and knowing the type of platform you should be focused on. And that's about the
Okay.
niche. Like, how can you, or what are the elements of what makes something the best niche for you? How can you recognize where you should function on social media and what aspects you should focus on?
Health is really broad.
That's
Um, it's a broad thing, and
mm,
I think I totally understand the angle of niches because
mm,
there's some type of clashes these days where medical doctors are giving information and nutrition advisory, and nutritionists are countering those information. Sometimes I don't get involved in these conversations, but I have worked in a multidisciplinary team, and
okay.
I think that if I want to talk about niching, I would approach it in this manner. A
Okay.
patient comes and presents with a disease that requires multidisciplinary experts, right?
Mm,
I, as a
mm.
medical laboratory scientist, I should speak to the part of it that concerns like within the
Thank you.
boundaries of my own work.
Yeah.
If there are other information that of course the patient should know, that general, of
Mm,
course you can put it out there, right? But I mean, it shouldn't be in such a way that you now tell, or the patient now feels that they should consult you as a doctor when you are a medical laboratory scientist,
mm,
right?
mm.
If you are,
Yeah.
for instance, a nutritionist, I
Mm,
don't know that you can start going in detail about certain kinds of surgeries when it is basically not within your area of expertise. I think that niching is very important because it makes it easier for people to say, oh, I have a challenge with maybe understanding my laboratory test. I have a challenge with
okay.
the nature of laboratory tests that I have been sent to. And I'm like, I know somebody that is popular on, on Twitter. I've forgotten that lady's name. She even used to have this laboratory test fair every year. And then you are like,
Okay.
oh, I can actually reach out to her to explain why. Because over time, she has been, every time she picks up maybe a health topic or a disease or anything, and she speaks about it even broadly, there's also that, that coming home where maybe she says, oh,
Mm.
these are the kinds of tests you should do because
Mm.
this is what this test should check for.
Check for.
When you get laboratory results like this is what it
Mm.
means. But also consult your doctor if you maybe need any further,
Mm.
medical requests and stuff like that. So I would say
Mm.
that from a multidisciplinary approach to caring for a patient, that it is best to speak around what your area of expertise is. Of course, it doesn't
Mm.
mean that you shouldn't touch other areas. There are
Alright.
certain things that
Mm.
you know are connected to your work that may be deeply concern the doctors, as long as you're not positioning yourself as what you're not. I think
Mm.
with niching, you can just maybe just be, I don't know how to put it, but I think the key word there is just make sure that you're with all the content that you put out there, that you're not intentionally positioning as what you're not. And I'll give
Not.
certain examples. If I'm maybe speaking about, I know this guy who constantly brings up things from his laboratory work. He shares, people engage, and all of that. I don't think that anybody can come to him and say, I have they have just told me that I need surgery, can I share my x-ray with you? Or call him, hey doctor, and then he'll reply when he knows that he's not.
It's
So I
not.
think I don't know that anybody can box themselves up, especially because health
Mm.
itself intersects across various areas. But I think the challenge
Mm.
here is, do not position yourself as what you are not.
Mm. Thank you for that nuggets. Do not position yourself as what you're not. Stay on your area of focus. Thank you for that. So it's been a very interesting discussion so far, and I'm looking at the questions that I had written down before. Most of them I think we've covered using some other question formats.
Okay.
However, as you close, like what are the things that you consider very important for any healthcare professional, any medical laboratory scientist that wants to have, a personal brand on social media this year and wants to make more community impact? What are those must have, must do's, and like final words that you want to share with them tonight?
Okay, I would say personal branding is not just what you are online, it is also offline. You must have values that that guide you. Of course, as much as there are values that guide the profession, which includes credibility, I think maybe respect for
Accuracy,
human
mhm,
accuracy and the likes. That should also
precision.
guide when you are that should also guide you when you are on these social platforms. Always
Yeah.
remember that how you share information is important. It has to be credible. It has to speak in a tone that doesn't that is not condescending.
Mm.
And when you are on these platforms, you want to start thinking, how do I make at least one person take out the information I'm sharing today? One person today. Don't do it like you're addressing a group of people, because at the end of the day, sometimes that information you're doing might might miss the mark. Just write it in
Mhm.
such a way, create that content in such a way that the person who is looking at that video or reading that thing per
Mhm.
time knows that you're addressing them.
Mm.
um that being said, on core values and the format and all of the other things that have to do with ethics, I would say that please invest in branding essentials. And these branding
Okay.
essentials include how you look. It's not
Mm.
about intelligence. People should enter your brain and your mind. Nobody is a working cardiologist, right? People have to see you to be able to hear you, also to
Mm.
be able to understand you. So presentation is important. If
Important.
you need
Yeah.
to get a really good headshot for your social platforms, that is
Mm.
fine and good. Also, go home to yourself and ask yourself, what are the kinds of conversations around health that I want to be involved in, I want to
Mm.
create, I want to contribute to.
Mm.
What do you want people to take away? What do you want them to see you as? Other people have branded. There's branding
mm.
of apropos doctor. So anything that has to do with health, you definitely have to chook mouth. There's the branding of sports doctor. There's the lab. Sorry, I'm trying to remember her brand name. I can't remember
There's
now.
a lab girl on Lens or so.
Yes,
I
there's lab
saw,
girl on lens. There's also
yeah,
another one of you
maybe
know,
lab coat girl.
thank you very much, lab coat girl.
And
So
then there
um
is
how
MLS Chelly. Yeah.
So yeah, so how do I present from what angle do I, come in? Don't try to, typically just copy others verbatim and then you are just there because I mean they're
Mm-hmm.
already way up there, so you're just going to go and drown under them. So your
Mm.
voice is powerful.
Yeah.
There's often this challenge of people thinking, I don't speak a certain way, I don't,
Yeah.
appear a certain way. What
Mm.
branding is that you're unique in your own way
In your
and
own
not
way, that's
looking for a
true.
way to
Mm-hmm.
multiply or become
Mm.
multiples of other people.
Mm.
Another thing I would say is engage in relevant conversations that surround healthcare. So you don't say, oh, you are writing about from your own platforms and then you're not engaging because that's literally how to even build the followership. When you engage in other people's content, their followers get to also see who
Get
you
to
are,
follow you.
understand your
Mm.
perspective as an expert, and
Mm.
then they can also follow and engage with you.
Mm. That's
Um,
true.
I think another thing that I would say is um, even if you realize that people are not exactly liking that content, always
Okay.
have in mind that the impressions are there. And I will give
Mm.
you an example. With Twitter, for instance, you can make a tweet that nobody likes, but then
That's
it
true.
has a view count of 100. People are
Mm.
watching. I cannot overemphasize this. I've been to random places and people are pulling out my tweets that nobody has ever engaged. And I personally do not wake up writing that, oh, this particular person must see this or see that. I just
See,
maybe write it out from my heart because that is exactly how I feel. But then I don't know that it has sparked conversations in other places.
places.
So this thing that people do where when they write a
Mm.
piece of content or do a piece of video, and after a while they
Mm.
don't get an engagement, they go and delete it. Please, if you are making up the mind that you're going to do branding, it's important that you go all the way. You don't cower out of fear.
Mm.
Always realize that those pieces of content are timestamps. One day you're going to look back to them, or somebody's going
Yeah.
to pull that up for them to
Mm.
use to educate themselves. So I think
Mm.
these are some of the things I have in mind. And one last thing is make sure that your nomenclature, your name, is constant across these platforms, whether they are
Mm.
usernames or your full name. If you want to
Mm.
use your first name across, that's fine and good. But don't answer maybe Chidindu on Instagram and then on Twitter,
Yeah.
yeah, sorry, your username is I'm Chidindu on Instagram. On Twitter, your username is something that has to do with cats and dogs, right? You want in such a way that yes, once one you can use one username across all platforms. It makes it
Yeah.
easy, right? So it makes it easier for
Mm.
you to be found. So I think that
Mm.
that's one other thing that I'd have to
So
chip in.
it has to be uniform and consistent across
It
all
has
the
to be
social
not
media
necessarily
platforms.
yeah,
Mm.
not necessarily uniform. If you can be uniform, fine and good. But there has to be some consistency. Like there are names that maybe when you want to take them on Twitter, you have them the same,
Somebody
maybe on
else.
Instagram and other places.
Mm.
Someone has taken it. You can have that,
Mhm.
maybe add something, maybe a figure or something, right? Or you can use another thing. That's also fine and good. But I just want
Mm.
to say
That,
that
that,
once you have
that's
decided to
where
take yourself seriously,
That's where I
you want
think
to
maybe
you want to
brand
walk
names
around being
may not
consistent.
necessarily be your biological name. You could have something like funny scientist or your sabi scientist, something that just points to you as a person because you were the first person to personalize it to yourself. So that if you're thinking, okay, I want to use my name, somebody else could have used it, and then you now have maybe Chidindu on Twitter, and then on Facebook you can't use Chidindu. You now have to use something else.
Another thing.
So, so I think maybe you can just pick something that relates to your focus, and then make sure it's consistent across all platforms, and find a way to link it back to your real name.
Yeah, great.
Okay. So thank you very much. We are already it's already time to just end this broadcast. But I wish we could keep on talking. Like, you've made this very interesting and lively. And I want to say thank you for honoring this invitation. And I believe that we have shared knowledge to our fellow professionals who will be watching this later on, or even for those who have been on the broadcast with us. So thank you very much. And
Thank you,
do you have
Onaoluwa.
any product or any, like, maybe email list or platform that you would want people to just connect to so that they can learn more from some of what you share on a regular basis? You can drop the link and I will share it with the platform, I mean, on the WhatsApp platform later. So thank you once more, and do enjoy the rest of the new week as we enter into a new week very soon. So have
Yeah,
a
thank you
pleasant
so much.
rest.
Yeah,
All
same
right.
to you. Well done. Super well done to
Thank
you.
you. Thank
Yeah.
you. So the classes continue, and depending on what others would prefer, we would either use Google Meet or use this YouTube. So do enjoy the new week, and God bless us all. Amen.